Good afternoon, everyone. I wanted to get a bit of a check on who's in the audience here. Do we have inventors in the audience? Anyone who's filed patents? A lot of you. Okay. Any inventors who have received royalties? Okay. Fewer of you. All right. Dennis asked me to come and talk about tech transfer, and I think the original title of the talk was Tech Transfer, Surgeon Innovator's Foe or Friend, or something like that. I've decided to tweak that a little bit. It seemed like a somewhat controversial topic, and we can get into that, but what I wanted to start off with was just talking a little bit about what tech transfer is. I don't know if many of you know about tech transfer or whether your experiences as inventors have been largely through personal efforts. As surgeon innovators, many of you probably work in hospitals, may not be affiliated with universities, and most hospitals actually don't have tech transfer operations, and therefore you may own your intellectual property and pursue those development efforts on your own. At Columbia, we have a number of affiliated hospitals. Our flagship hospital is New York Presbyterian, and the inventors at the clinician inventors at New York Presbyterian assigned their IP rights to Columbia. So with that, I'd like to just give a 30,000-foot level view of what tech transfer is as an industry, since we're going to try and figure out whether or not we're a friend or foe. Let's figure out who we are first. So why are universities in the business of tech transfer? If you look at the last 20 or actually 30 years or so of activity here, you'll see that the number of U.S. patents granted to universities over that time period has actually, I guess it looks like about 8x from 1980 to 2008. Universities are heavily investing in patent portfolios, and that looks like it's leveled out a little bit, but if you take a look at how that compares actually with industry, worldwide pharma R&D, which is well known for its heavy investment in R&D, was about $45 billion in 2007. Universities, hospitals, and research institutes combined had a research budget of about $50 billion. So we're on par, essentially, with the investment that's being made by pharma. And if you look at, sorry, I'm having a little problems with the device here. So if you look at top universities and compare that to top life sciences companies in terms of number of patents that are being issued on an annual basis, you'll see that the top universities and top life sciences companies anyways are really kind of neck and neck. So we're in the business of patenting. Patents come from sponsored research for the most part. We're at $50 billion annually in sponsored research, and over the course of 1991 to 2007, $500 billion has gone into the research enterprise in the United States, at least. And the folks at the NIH and then NSF and the DOE and all of the other agencies expect us to have something to show for that $500 billion worth of investment. So at the end of the day, we have a public mandate to commercialize and reinvest the fruits of research, and that's why we're in this business. So I also wanted to point out that tech transfer is a business that probably no one would really in their right minds go into because commercial success is actually extremely difficult. It's what we call a black swan business, so it's kind of like a lottery business. You have a lot of tickets out there and you hope for the big win. What this slide represents is essentially 2007 data, gross tech transfer revenues. These are licensing revenues from 155 tech transfer offices in the United States. And what you see essentially is that most tech transfer offices actually make zero tech transfer revenues. So about 60% of them, a little bit over half, make no money whatsoever. And that red line basically cuts off the point at which tech transfer offices actually make a profit, i.e. cover their expenses. So it's a pretty tough business to be in overall. Columbia in 2007 was number 2. We typically are in the top 3. We've been very fortunate, and I'll talk about the sources of that fortune later on. But number 1 was NYU with $730 million in licensing revenues back in 2007 as a result of monetization of their Remicade royalties. So when you win, you can win pretty big, but it's fairly unlikely. Again, along that vein, when we do have successes, it's the rare blockbusters that drive most of the tech transfer revenue. And just to kind of keep it in perspective, of the licenses that are entered into, only about 40% of them ever generate a single dollar. And of those that generate a single dollar, less than or more than a little bit more than 1.2%, more than 1.1% generate over $1 million annually. So the blockbusters, defined as over $1 million of license revenues annually, are fairly rare. Again, we've been very fortunate at Columbia to have quite a higher blockbuster rate, really as a result of a couple of, or I should say 4 big blockbusters. And so going back to what Ray was talking about, and also what Dennis was talking about, the time that it takes to develop a successful product, you can take a look at A, C, and D are basically all life sciences related technologies. A is the famed Columbia Richard Axel co-transformation technologies, foundational to biotech. Took 10 years to derive any significant revenue. This is after the deal was done in the early 1980s. In C, this is the chimeric antibodies technologies, took 8 years to generate any significant revenue, and then really another 8 years to generate what we would call substantial revenues. C, it's important to point out, was actually returned to Columbia because a major pharma who had tried to develop it during the first 8 years couldn't develop it and told us it was not worth developing. It was non-developable to them. We relicensed it to another major pharma, and it's a major blockbuster for Columbia to this day. D is the Xalatan royalties from latanoprost, which has now been reformulated into an eyelash growth technology for cosmetic applications. But again, 10 years to significant revenue. And again, this is from the time of license. If you look back to this slide, what you see is that actually it takes a long time from the time of invention to the point that a license is actually done. So this is Columbia data, and essentially it shows that over the licenses entered into, on average, or the median is 7 years by the time most of these licenses are entered into. So the patents are typically 7 years from the date of invention by the time they're licensed. So it often takes years to license a patent, and once you license, it takes years to develop a product, and it's not always obvious which ones the winners are at that time. So I wanted to just provide that overview of tech transfer as a very difficult business to be in. But at the end of the day, we do this for the same reasons that surgeons innovate, because it is about getting the ideas, the $500 billion of investment in the world of ideas, into products, goods and services that will help people. So I want to bring it down now to, I guess, more of a tactical level. Most people think about tech transfer and really have no idea beyond report an invention to the tech transfer office. Have any of you worked with the tech transfer office before? Only one? Okay, okay, all right. I know no one wants to admit it. Okay, so essentially, in a university setting, there's typically a tech transfer office an office that's set up to assist inventors with translating their inventions or their ideas to market. And the entry point into that is reporting of an invention to the office. In my years at Columbia, when I first started at Columbia had a great reputation making money, but didn't always have a great reputation with its faculty. Oftentimes, when I started at Columbia, I would hear, well, I reported an invention, but then I never heard anything after that. So what happens after that? Essentially, I might get a notice that the office has decided not to file my patent. I found out that I had a patent somehow, but it was never licensed. I never knew what happened to it. And then maybe years later, I might get a notice from the office saying, hey, we never licensed your patent, and we're going to drop it. By that point, you're frustrated and angry because you never knew that any of this was going on. And if you're one of the lucky few, you enter into a license agreement and you suddenly probably get a check in the mail, royalties, and never knew what happened. So the in-between is basically a black box to most people. And so what I wanted to do is basically just take a look inside that black box and explain what we actually do and how we can help. And then you can evaluate whether or not we're a friend or foe. But essentially it starts off with a commercial assessment and strategy. And this is actually a very, very critical part and foundation of the entire process, of this very long process that I had already described. And all of these things, defining the unmet need, understanding what the product profile is, understanding clinical adoption, regulatory, reimbursement, manufacturing, these are almost impossible tasks to figure out at the very beginning when all you have is a concept or an idea or a napkin sketch. But yet, we have to make some guesstimates, have some boundary parameters as to what these might end up looking like down the road. So there's a little bit of a crystal ball element to this, but these are the things that we must think about at the very beginning, because you can't not think about them if you're going to start to talk with investors, talk with entrepreneurs, talk with corporate partners. They're going to ask all of these questions. So we have to think about this very early, even though we may not have any idea what the applications are. The next step in the process is meeting with patent counsel. If you're lucky, you'll have a university or a hospital tech transfer office that has resources to file patents and patent applications. It's a very expensive proposition, as some of you already know. On average, medical device and biotech patents, which tend to be very complex, from filing to issuance, it's about $50,000 per patent. In a portfolio, you might have 4 or 5 different inventions restricted out from your original patent application that can easily mushroom into $250,000, and you're not even talking about foreign applications at that point. So working with a university tech transfer office or a hospital tech transfer office, if they believe in your idea, they'll put that investment money up front without any expectation of your reimbursement. So that's a service that we offer to our faculty inventors. It's a very intense process. I think Dennis and the other inventors in the room can attest to this, working with patent counsel. Again, if you're lucky, you get a patent attorney that is experienced in the particular device area that you're pursuing. If not, it'll be very painful and ugly. So if you do have an opportunity to provide input with your tech transfer operation in the choice of counsel, and they're open to that, then that's definitely something that I would recommend. If you know someone, if you've worked with someone else before who's an IP attorney, they understand your field, then that is definitely a recommendation you can make. And most universities and tech transfer offices are open to that. And it is extremely difficult to find good medical device counsel. Whenever we hear of that, we hear of good IP counsel, we try to sign them up. It's extremely difficult. And in fact, talking with investors, sometimes I ask them, what IP counsel are you using for your startups? And they won't even tell me because it is really that critical. They don't want to disclose that. It's a competitive advantage to have very good IP counsel, especially for medical devices. So in that process, the patent attorneys will go through a prior art analysis. This is where the inventor, especially clinician inventors, scientist inventors, can be very helpful because typically you know your business better than anybody else. You know what other devices are out there. You know what other competitive products are out there. That's all prior art that would be extremely relevant to basically circumscribe what your claims are. Claims have to be meaningful. They have to be commercially meaningful. It's very easy to write crappy claims, frankly, but it's very difficult to write claims that will actually allow you to defend your product in the marketplace, and that's really where your lawyers earn their billable hours. So the next step in that process is once you have something on file, typically your tech transfer office, in collaboration with the inventor, will start to do some market testing. In the device world, especially, we would go out and talk with end users. So these are other surgeons, other clinicians. We would talk with hospital purchasing departments to understand what their motivations are or what they would be for securing or signing up a contract for this kind of device if it existed. Talk with other technical experts. Typically, these would be engineering experts who understand how the technology is put together, whether or not it's feasible what you're asking an engineer to do. And also talk with strategic commercial partners. These are typically big medical device companies who, as Dennis alluded to, historically have helped to fund early development or even provide components or parts. That's less the case these days, but components and parts they might throw your way, or even with contract manufacturing groups. So we're starting to talk even earlier into the supply chain, talking with contract manufacturing groups who may either have excess capacity or may be interested in working with us on a revenue share basis. Further down the line, we have marketing. This is where, this is the roadshow aspect of this. So once you have a package, you kind of know what your technology is, you know what the applications are, then you can start to go out to industry and investors and entrepreneurs to shop your idea and get real market feedback or money market feedback. If that results in a positive discussion, you end up in a license negotiation and closing a deal. There's a gap in between market testing and marketing, which is intentional. This is often what you might have heard of as the valley of death, or the proof of principle gap. This is typically, between market testing and marketing, is typically where most university early stage inventions die. They get part of the way through and maybe not make it all the way there. Dennis has already talked about the types of resources that can be brought to bear during this process, but essentially, this guy's actually already ahead of the curve because he at least has a prototype. Many of the inventions that we get, particularly from clinician inventors, surgeon inventors, are purely conceptual. There's a diagram, and there's a vision, and there's a passion. And after that, there's no engineering, there's no prototype, and as Dennis alluded to, and also Ray earlier, both of you had biomedical engineering or computer science engineering collaborations that allowed you to move forward. So in a university environment, most universities have engineering schools, or if you don't have an engineering school, you should look for an engineering school. The best engineering schools, in my opinion, are technical institutes, not necessarily academic departments, and that's because they have people who really know how to put together on a shoestring these devices. I think in both of your cases, I think Dennis and Ray, I think it's exceptional that your tenured faculty members were willing to spend time essentially building prototypes. But I think in both of your cases, you also got funding for that, so it was easy for them to do that. But engineering faculty are untenured. They have to write grants like everybody else, and they're not always open to basically making time to build prototypes. That prototypes don't lead to publication typically unless they're associated with a grant. So this valley of death, I wanted to focus on this a little bit and talk about some other resources. For surgeon inventors, one of the great resources is the Coulter Foundation. Has anyone here heard of the Coulter Foundation? No? Okay. Okay, some of you have heard of them. The grants that they give out are pretty much to biomedical engineers, but all of their grants have to have a clinical collaborator. And it is extremely important to have that engineering clinician team working on a project. And those are very nice grants. They're $250,000 for phase 1 and another $250,000 for phase 2. They go through, they team you up with a mentor, help you, they retain SBIR consultants to help you out with SBIR grants. They connect you to VCs. That's just one of many resources. I think, getting through this valley of death, if you're a tech transfer office, or even you as individuals, if you don't have a tech transfer office, the key to getting through this process is really networking and getting as many people in your ecosystem as possible to listen to your idea and to help bring resources to bear. In certain areas of the country, that ecosystem is richer than others. In Cambridge, in the Bay Area, other areas of the country, including Cleveland and New York, are trying to build those efforts, but it's pretty hard. So I think, again, the key to that is, talk about your idea with people. I think many inventors have a concern about disclosing their ideas, but if you never tell anyone about your idea, you'll never get anyone interested in it, and you'll never get money to fund it. So I think networking is a big part of trying to get the right resources and the right people to help you get through this proof of concept gap. So I wanted to talk about this slide a little bit. It's actually kind of dense, but essentially this is the spot that we're talking about, this valley of death. And the NIH has a number of programs. Dennis talked about those, the SBIR and STTR programs. And I'll say that most of the SBIR applications, I think, surgeon inventor applications, I think, would be very competitive, because most of these SBIR applications are written by business people who have no understanding of the technical or clinical aspects of the application. And I think an academic scientist, academic clinician applying for an SBIR actually already has a leg up on the competition, so to speak. They just announced a couple of weeks ago an increased award levels for the SBIR. Phase 1 is now 150, and that's the minimum. And if you work with a good SBIR consultant, or even if you don't, you'll know that you can ask for much higher than that. Actually, the average SBIR phase 1 is closer to 200, 250K from the NIH, not 100K. So even though the program announcement says budget of 100K, if you justify a higher budget, you can get 250,000. And the same for phase 2. I think the phase 2, you can essentially, you have over a 50% chance of getting a phase 2 if you get a phase 1. So it's a very good program, and it really helps. It really helps if you are already have some grant writing experience. So I just wanted to provide. Am I running out of time? 2 minutes? Okay. I also wanted to provide just some paint a picture of and some profile of who you're working with in the tech transfer office, And this was a quote that I had heard from Bob McWright, who's no longer at UVA Patent Foundation, but typically the type of person who is in a tech transfer office is someone who is almost someone who has multiple personalities, and not in a bad way, in a good way, because we often have to deal with in a given day, we can be talking with the CEO of a biotech company, but also talking with a student inventor and trying to explain patent law to them. So it's a group of people who have, I think, some very very specific skills, but also who typically in the course of a day have a lot of challenges that they have to face, very complex topics to very basic topics. And so when you talk with your tech transfer office, the best thing that you can do is essentially understand what what motivates them, what incentivizes them to work with you. And if you can establish essentially a trust relationship with them, they can be a real advocate for you. And this is what we try to do at Columbia. It's not, I have to say, it's not always successful, but we try and make it as successful as we can. I wanted to provide a few just case examples of device development projects gone awry and gone positive, but I'm not sure I have enough time. I'll just briefly provide an overview of the work that Dennis and I did together. When Dennis and I met, which I guess was in 2003, he had already had some ideas for his device and already had an R21 in the picture. One of the grants that Dennis didn't mention was a NISTAR grant that we got for $750,000, which is a lot of money for a device development, early stage device development project. And that was a nightmare. Even though we got the money, we had to get corporate match on $750,000. We actually found an entrepreneur who was willing to put some money, his own personal money, into it, and entered into negotiations with that entrepreneur. But in the course of that, he actually passed away. And we went to the state and we said, our major investor has gone away. Has passed away, he's not coming back, but we have another investor who's willing to enter into the picture, and they refused to transfer the grant to the new entity. So we lost out on $750,000, which they then later got other grants for, but there's a lot of bumps in the road. And I think the best way to work with your tech transfer office is as a long-term partner. And so with that, I will end. Thank you. Whoops.